Developing and manufacturing drugs is an expensive process, and one of the biggest expenses involves a characteristic of chemical compounds that has been a huge challenge for drug developers. And the easiest way to explain it involves this.
Mirror images. When you look in the mirror, you still look the same, but the image is reversed. So tell me if I am left or right-handed. Right, actually. And it's the same for chemical compounds. They can also be left or right-handed. And this is really important because their shape affects how they interact with our bodies.
A tragic example is the legacy of thalidomide. The drug was used in the 50s and 60s as an anti-nausea drug, but when used by pregnant women, the compound's mirror image caused birth defects.
We spend billions of dollars each year to separate the two sides of these chemical compounds, where the mirror image drug may have unwanted or harmful side effects. For you and I, that might be a drug that we need at a price that we cannot afford.
Until researchers at the University of Western Australia made a startling breakthrough.
Our research has discovered a cost-effective way to separate the left-handed and right-handed forms of molecules, which has a significant impact for the medical industry.
Emma Patterson was doing her PhD on dark matter when she made the startling discovery which had nothing to do with what she was researching at the time.
We were searching for dark matter, and as part of that, we had invented this twisted light inside of our devices. And while we were researching this twisted light, we found that we could manipulate chiral molecules with it. And more importantly, we could do this in bulk, which no other device has been able to do before.
This seemingly simple observation is a big deal. Currently, more than half the drugs approved by regulatory authorities are both left and right-handed, and we can blame costs and time.
So currently they use high-performance liquid chromatography, but this is really expensive, slow process, and for one device, it only produces like a few milligrams per day, and it's on the scale of 100K per device. So that means that it's currently too expensive sometimes to produce the pure form of many molecules, which means that the side effects associated with the wrong-handed form of the molecule just have to be put up with.
So how soon before we see Emma's breakthrough in operation outside of the lab?
We've already constructed prototype devices at the QDM labs at the University of Western Australia. Our device would cost roughly 10K per device, which is a huge reduction in cost from current technology. And we aim to get the final product out in about 5 years after some research and development. And our devices will be able to process in bulk.
This innovation demonstrates the value of fundamental scientific research and should result in a greater variety of, and cheaper, medicines.
And who knows, in Emma, WA could have its next Nobel Prize winner.